Can you smell this? Getty Images. Stephen D. Munger, University of Florida, and Jeb M. Justice, University of Florida. Doctors from around the world are reporting cases of COVID-19 patients who have lost their sense of smell, known as anosmia, or taste, known as ageusia. The director of the University of Florida's Center for Smell and Taste and the co-director of the UF Health Smell Disorders Program answer questions about this emerging trend. Is the loss of smell an early sign of COVID-19? Loss of smell occurs with the common cold and other viral infections of the nose and throat. Anecdotal reports suggest the loss of smell may be one of the first symptoms of COVID-19. Doctors around the world are reporting that up to 70% of patients who test positive for the coronavirus disease COVID-19, even those without fever, cough or other typical symptoms of the disease, are experiencing anosmia, a loss of smell, or ageusia, a loss of taste. A new study just published found that 20 of 59 patients, ages 50 to 74, interviewed in Italy reported a smell or taste loss. More research is needed to understand this link, but it may provide a low-cost, practical indicator of which people should self-isolate or get further testing, depending on the symptom severity and testing availability. What are anosmia and ageusia? A number of chemosensory disorders result in the diminishment, distortion or complete loss of smell or taste functions. For example, anosmia is the complete loss or absence of smell, while hyposmia is a reduced ability to smell. Similarly, ageusia is an absence of taste. Approximately 13% of people over 40 years old have a significant impairment of their sense of smell. These numbers are lower for younger people, but significantly higher for the elderly. By contrast, taste loss is much less prevalent, and often results from physical damage to the taste nerves. Even so, both smell and taste disorders are quite common and can have major negative impacts on the health and quality of life of the millions affected. According to news reports, many of the COVID-19 patients reporting a chemosensory loss describe a loss of taste. However, it is more likely that smell loss accounts for this symptom. When we eat or drink, the brain combines our perceptions of taste from the mouth with what is known as retronasal olfaction, that is, the perception of smell that comes from odors leaving the mouth and entering the nose through the connecting passage in the throat into what is specifically called. Patients who have experienced anosmia or severe hyposmia may describe a loss of taste but are still able to detect sugar, salt or acid on the tongue. What they have lost is the contribution of smell to their perception of flavor. We would predict that in most cases, the taste loss reported by COVID-19 patients is likely due to a reduced or absent ability to smell. Thanks for watching. Please subscribe and go to North Denver News.com for news.